Welcome to Canadian Justice. I'm Christine Van Geyn, and today we're discussing recent changes announced in Ontario to what are called safe or supervised drug injection sites. These are facilities that allow people who are addicted to drugs to bring their own drugs to use in the presence of trained staff. The idea is to reduce overdoses and provide clean needles. But the sites have attracted criticism. A mother of two was shot and killed as she walked past an injection site in a residential neighborhood in Toronto. The sites attract not just drug addicted people, but also their criminal drug dealers. Following the murder, Ontario launched a review of the sites and recently announced that they would be banning them within 200 meters of schools and childcare centers. As a result, 10 facilities will be required to stop providing supervised drug injection services by March of next year, but they can transition into providing drug treatment options. Today, we will debate the merits of this change, first with journalist Adam Zivo, who's been investigating the issue, and then by libertarian think tank president Matt Bufton of the Institute for Liberal Studies. Adam, thank you so much for joining me today. First, let's get your reaction to the changes. What do you think of the closing of these sites near schools and daycares?
I think that on the whole, this is a very positive development. I think anyone who lives near these sites can testify to the fact that they are engines of public disorder and public drug use. Though they may have some benefits for drug users, we have to consider the cost to surrounding communities. Many of these sites received complaints year after year after year about the fact that surrounding residents didn't feel safe. Those sites didn't take them seriously, and now this is the natural consequence of it. And of course, all of this is amplified by the fact that oftentimes kids are just trying to live their lives and go to school near these places. They deserve to feel safe as well.
I think a lot of people watching this might be shocked that the sites, 10 of them, were so close to schools to begin with. So, what's your take on why they were even permitted to be so close to schools and daycare facilities?
Well, I mean, many of these places are in densely populated urban areas where it is hard to not place them near schools. And I think that many people assume that public policymakers would be more considerate of the potential spillover harms to young people. However, public health experts and harm reduction researchers don't really factor in public safety, and they tend to downplay or gaslight people who express these concerns. So I think that this is just something that happened as a natural and accidental consequence of implementing a harm reduction initiative in an urban area with harm reduction researchers who just didn't think about other populations that might be harmed.
So I wonder if maybe you can paint a picture of what things look like around these facilities for people who might be watching this and they don't live near a site like this. What is it like around them?
Well, so Derek Finkel, who's a journalist with the National Post, expressed this very clearly. He lived beside the South Riverdale site in Toronto, and he said that for years, people felt terrified because you would have active drug users and drug dealers surrounding near these sites. They would then steal all the time from surrounding residents. They would threaten surrounding residents. One woman, for example, threatened to burn a woman's house down while her kids were inside. She emphasized that she would burn it down while the kids were inside. The supervised consumption sites didn't care about this. When residents tried to raise their concerns, they were told that they were essentially NIMBYs. There was a hostile environment. There was no real response. Police were discouraged from doing their jobs near these sites. So essentially, we created a lawless zone. And over time, people just felt unsafe. You had kids picking up pieces of fentanyl, kids constantly walking by people overdosing and finding syringes everywhere in places where they should be playing.
So that's interesting because I think the defense of these sites is that you won't find syringes or drugs lying around because there's a facility where they can go and be used in a supervised manner. So like how do those two narratives match up?
Well, I mean, there's a huge gap between how these sites are supposed to work in theory and how they work in practice. So people are supposed to use drugs inside these sites. That doesn't happen. Oftentimes, they use these facilities slightly, and then they just continue using drugs rampantly outside because this is where all of their friends congregate, and this is where all of the drug dealers congregate. So we have to keep in mind that supervised injection sites claim that they will control drug use, but in fact, they merely concentrate it and create a nexus of chaos.
We've got to go to commercial break now, but when we come back, I want to talk about what instigated this review of the sites. And it was the murder of this mom of two named Carolina Hubner Makarat, and what we know about her murder. We will be right back. Welcome back to Canadian Justice, where we're discussing recent changes announced to Ontario's supervised drug injection sites. And these changes were instigated after a review of the sites following the murder of a mom of two in 2023, a woman named Carolina Hubner Makarat. And she was hit by a stray bullet. She was an innocent bystander walking near a safe injection site in a residential community. Adam, what do we know about her murder?
Well, so the supervised injection site, or rather supervised consumption site that I was describing in the previous segment, happens to be the one that Carolina was murdered by. So we know that for months and years preceding her murder, that there were problems with crime and drug dealers, and that local residents were trying to raise these issues to the site only to be ignored. And at one point, one of these residents even told their fellow activists, or rather fellow residents, who needs to be killed before they start to take this seriously. So she was hit by a stray bullet by two drug dealers, I believe. And then the really scandalous part of this story is that a harm reduction worker who was working at the supervised injection site has now been charged with abetting this murder by after the fact by trying to hide the suspect from the police. So helping the suspect escape justice. And that's the part that really reinforces how grossly unprofessional these sites are and how they are grossly mismanaged. And they are not the kind of medical sites that many harm reduction activists want you to believe.
Now, there has been reaction from those activists to the decision to close centers near schools, and they have said that the closure of these facilities will lead to people dying. What is your reaction to that?
I think that is more contentious than they claim. I think that the evidence on safe supervised injection sites tends to be rather mixed. And there's been questionable things done with this research since the early 2000s. So I'm going to use a quick example. So Insight, which was the first supervised injection site opened in Canada in 2003, was reviewed by two doctors who produced 30 glowing evaluations of the project. And these two doctors who were harm reduction researchers said that Insight, reduced crime, created thousands of referrals to recovery. At that time, the RCMP thought that this was a bit questionable, so they hired their own evaluator to evaluate these evaluations. And the RCMP discovered that the researchers had actually fudged the data or misrepresented it. And one such example is they said, well, we made thousands of referrals. Well, a referral in this case was defined as simply handing someone a pamphlet. So, Christine, you come in, I give you a pamphlet, you throw it in the garbage. 30 seconds later, that still counts as a referral. The second piece is that if you looked at just the crime stats, it would suggest that crime was dropping. However, when the RCMP evaluator spoke with local police contacts, they said that actually there was a giant spike in crime and they had to allocate massive police resources to restore order. So this is just from 2003. Since then, you've had in the harm reduction space a lot of questionable research, a lot of ideologically motivated research, a
Mhm.
lot of misrepresentation of stats. So when they say that this is necessarily going to cost lives, I would take that with a grain of salt.
So, Adam, I want to put to you the argument that the guest in our next segment is going to make. He argued, his name is Matt Bufton, and he argued in the National Post that the current decriminalization system we have with supervised drug injection sites is a half measure, that what we need is the full legalization of drugs with a safe, reliable, and legal supply, and that supervised injection sites concentrate addicts into a small geographic place that creates problems, and that drug legalization would be better than our current half measure system. What's your reaction?
I mean, I think it's absurd. There is no such thing as a safe supply of drugs if you're dealing with things like fentanyl, like heroin, like pharmaceutical opioids that are as strong as heroin, with crystal meth. None of that is safe. So often, libertarians and harm reduction activists try to say that as long as we legalize drugs, the harms associated with drug use would be mitigated. But we have decades of research showing that if you increase the supply of drugs and you decrease the barriers, decrease cost, decrease perceived risk, that use and addiction goes up. Yes, having these supervised injection sites does concentrate users in a few central nodes. But if we were to legalize drugs, we would see this level of drug use everywhere. We saw this with the OxyContin crisis of the 2000s and late 1990s, where we had a flood of legal opioids into North America. And guess what? It cost us hundreds of thousands of lives. We've been there, we've tried it, it doesn't work. We have to be realistic. We cannot, sacrifice our society to some libertarian fantasy.
Adam, thank you so much for joining us and for your continued reporting on this issue. Welcome back to Canadian Justice, where we're discussing recent changes to supervised drug injection sites in Ontario with a policy announcement that these sites will no longer be permitted close to schools. We're joined now by Matt Bufton of the Institute for Liberal Studies, who's recently written in the National Post about the need not for decriminalization, but for full drug legalization. Matt, thanks for joining us. Let me hear your case for full legalization.
Thanks for having me, Christine. I think that the case for legalization really has two elements. And one of them is just a sort of moral element that, as consenting adults, we should have the rights to consume the substances that we choose to. And it's not the business of other people to come and tell us not to have alcohol, not to have caffeine, not to eat, fatty fast foods. And I would expand this to other substances that people may want to use that you or I may think are not healthy. We may not want to use them ourselves, but it's not our place to forcibly stop other people from using those substances. Then there's a second sort of more utilitarian argument, which is how effective are we going to be if we make those demands of people? And I'm going to say not very effective. I think we've seen this. We've had a long period in this country and other countries of drug prohibition where people are not allowed to buy or possess or consume these substances. And if making those commands and prohibitions was effective, then we wouldn't have people addicted to hard drugs that we see. We try to make them illegal. It doesn't work. We can't stop people using them, and the illegality actually makes them worse. It is harder to be an addict of a hard drug, heroin, cocaine, these things that are illegal, than a legal substance like alcohol. I can use caffeine or tobacco as examples of substances that people can have addiction problems with. We don't try to address that by making them completely illegal. We have them within a legal framework.
So one of the things that you've argued is that the social problems that we see around social injection sites, including discarded drug paraphernalia like needles, the concentration of criminal dealers, the concentration of people who are on drugs and are unstable, likely suffering from mental illness, as well as the crime we see concentrating, including that horrific murder that we discussed in the last segment. And you say that that's because these problems are concentrated around those sites. But why wouldn't we expect to see areas where drug users concentrate, even if there is full legalization, for example, under bridge overpasses?
Well, I think under legalization, there would be no reason to congregate under a bridge overpass, right? Like you don't see people drinking coffee or smoking cigarettes or drinking beers under bridge overpasses. I mean, maybe sometimes, but that's not principally where they are, right? They're in lots of places spread out throughout a city. So the analogy I like to make is what happens if we sort of kind of banned alcohol, but then we said we're going to have 10 bars in the city of Toronto. And then all the people who wanted to use alcohol, at least legally and perhaps safely, had to be in those areas. They would get much, much worse. Now, of course, there's the degree of concentration, right? There are districts with more bars. People who consume alcohol tend to congregate around bars. But there are, I assume, thousands, maybe tens of thousands of places serving alcohol in the city of Toronto. And so people are more spread out. They're more dispersed and less concentrated, and that is going to make the problems lesser. Now, it doesn't mean there's never a problem with a bar, but it does make it a lot better, I think, than if there were only 10 or 20 of these places.
So you've made the comparison between alcohol and these drugs. And Doug Ford was recently asked about this difference. He was asked about the expansion of alcohol into corner stores and how he reconciles his decision between expanding alcohol sales and restricting supervised drug injection sites. And he rejected that comparison, saying that there just is no comparison between a fentanyl and a Coors Light. So why do you think that that is a fair comparison? And what do you make of the argument that it's not?
I think we can absolutely make a comparison. Now, of course, these are different substances. There's all sorts of differences that we could discuss. But part of the situation is that when we ban something, we have a really strong incentive to sell it and to consume it in its most powerful form. So this is why fentanyl is so popular as a street drug, because it's incredibly powerful, incredibly small quantities you can smuggle and sell them for high prices. You might think of this in the consequence to or in relation to alcohol prohibition. If we had alcohol prohibition, would people be drinking Coors Light? No, there'd probably be a lot more emphasis on like liquor, maybe vodka that you get up to 98, 99, whatever the highest percentage you can get is, because it just makes more sense to consume it that way. When you consume it that way, you have problems. And of course, the illegality is its own problem. Even in a system of decriminalization like we have, there is no legal way to produce and sell it. I think that's a key problem.
We've got to go to commercial break, but we'll continue right after this. Welcome back to Canadian Justice, where we're discussing the recent decision in Ontario to close supervised drug injection sites near schools and daycare. So, Matt, what is your take on the government's decision to close the facilities near schools?
I would be interested to see how this maps out when you actually look at the city as a whole. It seems like a reasonable compromise to say, okay, we're going to maybe have these places, not have them near schools and daycares. And yet a city like Toronto has a lot of schools and a lot of daycares. And are we really putting most of the city off of limits with this sort of restriction on them not being able to be within 200 meters?
I mean, if that's the case and it's densely populated and you're weighing those two interests, wouldn't it be a fair compromise then to make the decision in favor of protecting children who can't protect themselves?
Perhaps. I'm a little skeptical of the idea that, if you had a supervised injection site or a safe injection site 180 meters from a daycare, that this would put children in any sort of harm or jeopardy. If there is, we should sort of make that case and not just think that, if it's anywhere near the children, we have to protect the children. A lot of bad policies are justified by protecting children.
So I think I agree with the part of your column where you conclude that decriminalization, this kind of half-measure policy that we've seen, where people are not charged with personal use, possession of hard drugs, and the corresponding creation of these supervised drug injection sites. You've written that this has created a backlash, and as a result, many people are now arguing that full drug prohibition is better than this half measure. And I do think that is what is happening. I think that the pendulum has swung. People are now really pro-prohibition. And I think part of the reason is because of the serious social issues we see around these sites. So what do you think might be fueling the backlash, and why do you think prohibition is the wrong solution?
I think we're seeing a backlash because people are seeing that a lot of the problems that are caused by prohibition are still in place when we have a ban on the production and sale. And again, I think it's incredibly important to know that drugs that we currently think was being very dangerous, very powerful, very addictive could look very different in a legal format where people could produce them, they could be reliable, people who are using them could know what it was they were putting into their bodies, and they wouldn't have to take them in their most powerful form because they could get them in a more reliable, more diluted form from a seller they could trust.
Let me push back on that a little bit, because I do think that fentanyl is the drug of choice for some users. It's certainly not for others. Like some people addicted to drugs might prefer a different drug, but they'll settle for fentanyl if that's the only thing they can get. But there definitely are users who prefer fentanyl. And honestly, fentanyl, even if screened for contaminants, is an extremely dangerous drug. I would suggest it's perhaps not safe to consume in any form at all. It kills people often the first time that they use it. So are you not concerned that legalizing a drug that is so dangerous would have really serious social repercussions?
I think this is a great example of the case that I'm talking about. Fentanyl is used in hospitals across Ontario every day, many, many times as a painkiller, as a way to help patients deal with pain. And when you go into a hospital and if they tell you they're going to give you fentanyl related to some sort of surgery operation, you're not concerned that they're going to be contaminated, that you're going to overdose, because you have professionals who are used to dealing with it, who know exactly what sort of doses to be dealing with, and they've got it, in a cabinet. They know exactly what the strength and the power is behind that. If you could buy fentanyl, and that's what you wanted to use in a system that was safe, regulated production, it would look more like that and a lot less like taking something off the street that you had no idea what the potency was.
Wow, it's a really fascinating article and a really fascinating argument, Matt. You certainly are courageous to come out with it. I want to thank you for sharing your ideas and your thoughts, and for coming on and being so brave to express them. So thank you.
Thanks for having me.
We've heard today about the debate over Ontario's decision to ban supervised drug injection sites near schools and the debate over drug legalization, decriminalization, and prohibition. The opioid crisis has devastated communities across Canada. What do you think is the best solution to this complex social problem? You be the judge. Thanks for watching, and remember, a freer Canada starts with you.